Okay, the topic for this lecture is the middle ear system. We've already discussed the external ear and its role in transducing or transforming sound from the environment. Now we're going to talk about the middle ear, which is still part of the mechanical transmission of sound. So the middle ear is a hard-walled cavity in the temporal bone. It is filled with air. Four primary structures within that middle ear space are the tympanic membrane, the ossicles, eustachian tube, and then the middle ear muscles. And those muscles are responsible for contracting to moderate to loud inputs, and we'll talk in a little more detail about those muscles. So here you can see the middle ear space, which starts with the tympanic membrane. You have your ossicles, stapes inserted into the oval window, facial nerve that courses through the middle ear space, a portion of the facial nerve. So one of the clinical correlates of the middle ear structures is that sometimes when the ENT physician is doing a middle ear surgery, if they bump, touch during the surgical procedure, the facial nerve, the person can have facial nerve paralysis for some time after the procedure. So that's one of the risks they go over. Here's the eustachian tube, which aerates, equalizes pressure from out here to in here, tympanic membrane, and other structures. But again, it's encased in the temporal bone. You'll hear it referred to as the tympanum or the tympanic cavity. In the textbook, it says the tympanum. In the new text, I refer to it as the middle ear cavity or tympanic cavity. So we'll talk about some landmarks. The promontory is this rounded part of the cochlea that you can kind of see from the middle ear space. The round window is a turn, it's an opening that allows for the fluid pressure to be spread out, I guess, if you will, throughout the whole structure. And then the oval window, which is where the stapes insert. So if you think about the cochlea as a closed system, the oval window is where the stapes vibrates. The round window, so as the stapes vibrates inward on the oval window, the round window is pushed outward, and you'll see that when we get to the sensory system. Here's another visual, of course, eustachian tube here, which aerates that. The cochlea, cochlear nerve. You have your vestibular system. Now these are sensory systems. We're talking about the conductive middle ear space right here, external ear canal. So one thing I wanted to go over is when we talk about the pinna and how the pinna has a resonant frequency of about 5,000 hertz. What we do is to measure that, we measure it right here because this is the entrance. So we would measure where the peak resonance would be right here if we're studying just the effect of the pinna. Now, if we were studying the effect of the pinna and the ear canal, you guessed it, we would measure that right here. So it includes not only the effects of the pinna, but also the effects of the external canal. Hopefully that makes sense. So the tympanic membrane, there's 3 layers. Don't worry about all those little 8mm, 9mm details. Focus on the 3 layers, outer, middle, and inner layer. The outer layer is just continuous with the lining of the skin in the ear canal. The middle layer is really important. That's the fibrous layer. It has both fibers that are radial radial fibers and then concentric fibers. So basically you have fibers that course kind of north, south, east, west, and then you have these radial, these kind of circular fibers, if you will. And so those fibers really give, that middle layer gives the tympanic membrane its strong structure. The inner layer is just continuous with the mucosal lining of the middle ear space. Okay, because the middle ear space is all lined with mucosal structures. So you can see those fibers here, right? And then you can see these, circular fibers, and then the more radial fibers. Okay, this is the manubrium of the malleus, which we'll see in other slides. So here you can see the manubrium of the malleus, right? You can see the cone of light. That cone of light is a reflection off the cochlea. So the promontory, that's what the cone of light is. It's a light reflection from the promontory, which is the bony portion of the cochlea. You get this annular ligament that kind of holds everything in place. There it is right there. And then you have different parts, pars tensa, pars flaccida. Not really worried about those structures, but really the manubrium of the malleus, cone of light, annular ligament are really important structures. That looks messy to remember. Okay. Here's the cone of light in real world pictures. You tell left versus right, but that's not really that important for this point in your academic training. We're not going to go a lot into the articular chain. Basically, I want you to remember malleus, incus, stapes in that order, held in place by these tendons and muscles, the tensor tympani and the stapedius muscle. If you remember back, the stapedius muscle is the one that's heavily involved in the acoustic reflex. You can see where they articulate here and here. Okay, so this is the malleus, obviously. Here you can see its articulation points with the incus. Okay, and then this articulation points with the stapes. All right, but this is the manubrium. This is the part you see when you do an otoscopic inspection. The incus, you get the long process, the short process. Again, incudostapedial joint. You don't have to worry about that, but that's where this joint is here, where it touches. And the stapes. So in cases, disorders like, we'll talk about otosclerosis, which we talked about in 342. If you haven't had that yet, otosclerosis is essentially when you get some sclerotic bone that fixates. Let me type that out too. Sorry, it's hard to do on my touchpad. Otosclerosis. There we go. Forgot where it was. Basically, you get a resorption of the bone, and it creates this stiffness that doesn't allow the stapes to vibrate appropriately. And the foot plate is what the surgeons will then remove all of this, put a new prosthetic on there in hopes that it can restore that function. Now, type of hearing loss, right? One thing I think is important to mention now is any disorder that causes hearing loss due to the conductive mechanism or the external or middle ear space causes what we call a conductive hearing loss, meaning that the sound is less able and efficiently traveling through the auditory system. So here's the whole altogether now picture. You can see all the joints here. You don't have to remember these, but yeah, that's the whole ossicular chain together. Eustachian tube, right? We've talked a little bit about this. Its job is to open and close, to aerate the middle ear space, right? You can open and close it yourself. Most people can by opening their mouth, chewing, yawning, doing something like that. That innervates the muscles. I always take that out. The levator palatini and the tensor palatini muscles. Okay, just forget that word. The levator palatini and tensor palatini. Basically, those are muscles that pull the eustachian tube, which is like a sphincter, right? It's a hole that has muscles that pull in the opposite directions to open it up. Okay, it allows for the middle ear space to basically get fresh air. I mean, that's what it does, right? When the pressure gets high in there from the eustachian tube not opening and closing, the mucus comes out of that lining, and that's how you get fluid in the middle ear space. Okay, so it's that structure's extremely important, right? Particularly in children, you can see the differences between an adult In a child, it's more horizontal. In adult, oops, you can see it's more vertical. So it's easy for stuff to travel from the nasopharynx back into this middle ear space, right? It's a little harder when it's more vertical. Those muscles that innervate that are as well developed in kids as well. So that's the other issue that causes increased eustachian tube dysfunction, which leads to middle ear problems, right? Here you can see the opening. Here you can see when it's normally closed. There you can see when the eustachian tube is open and those muscles are pulling in different directions, okay? There's another visual there. But again, from the middle ear space down to the nasopharyngeal area, right? You can have bacteria back there, and that can travel. That's one reason for ear infections. The middle ear muscles, the tensor tympani and the stapedius muscle. Stapedius is the primary muscle for the acoustic reflex. It's innervated by the facial nerve, and then the tensor tympani is innervated by the fifth nerve, or the trigeminal nerve, and they're antagonistic, meaning they pull in opposite directions to kind of purposefully stiffen the middle ear system. So that way you get a reduction in hearing sensitivity, particularly for low frequencies. They think it's a protective mechanism, and some other theories have been floated around about reducing low frequency sound transmission to help hear a noise. Those are two of the primary theories. So when we talk about the combined effect, right, of the outer and middle ear, you're going to notice this. This is the MAF curve, essentially. So this is what, right, or MAP curve. So this is, again, over and over, this is what we've talked about. It takes more low-frequency energy to innervate and hear low-frequency sounds, and it's because of the structural system, the outer and the middle ear space. So I have something I want you to think about. So if I played a white noise from the front of the classroom, okay, and this is the spectrum of a white noise. You see how it's pretty equal. So if I drew the spectral envelope, you get a pretty equal distribution of frequency energy across all the frequencies, right? If I were to play this sound from the front of the room, right, and let's say somebody in the second row, third row, someplace fairly close, if I played this sound, how would the ear transmit this, and how would it transform this to the middle ear system, to the cochlea? So think about if I played that white noise and it passed through a system that looked like this, what would the spectrum look like for that white noise after it has passed through the outer and the middle ear? That's where we're going to start and talk about on Monday. But I want you to think about that and draw it, sketch it up. Draw this spectrum and what it would look like if it passed through that system. All right. The middle ear provides what we call the middle ear transformer. It basically makes the impedance matched between the cochlear fluid, which is a higher density, than the air molecules, right? And we've talked about this other classes as well. There's three different mechanisms. You can kind of think of the thumbtack, right? So if you have a thumbtack, right, you take all the pressure from here and concentrate it on in that area, and it's easy to insert thumbtacks because, you have all of the pressure from this area focused on that smaller area. And the same thing with the middle ear system. Take all the pressure from the tympanic membrane and funnel it down to the stapes. And we'll talk more about that. But that's the impedance matching transformation that the middle ear system does, is the primary purpose of the middle ear. And here's some summary stuff. Again, we'll go over this in a little more detail, but I wanted to give you some information before class. Think about the question I ask, and I want you to try to sketch up what you think the spectrum of a white noise that I showed you would look like after it had passed through that outer and middle ear system, which basically acts like a filter, right? It changes how that white noise would look. Okay, so think about that, sketch it up, and we'll talk about it in class.